Xifaxan is a medication used to treat diarrhea caused by the common bacteria known as E. coli, also known as traveler's diarrhea. It should not be used if you have a fever or bloody diarrhea. Xifaxan works by stopping the growth of bacteria and treats only bacterial infections, not viral infections like the common cold or flu. It is also used to treat irritable bowel syndrome with diarrhea and to prevent a brain problem caused by liver disease, known as hepatic encephalopathy. Xifaxan may help improve clarity of thought. The daily dosage and optimal timing for taking Xifaxan will depend on the individual's condition, and it's important to follow the instructions of a healthcare professional. Before starting Xifaxan, make sure to read the patient information leaflet from your pharmacist. The dosage will be based on your medical condition and response to the treatment. For traveler's diarrhea, take Xifaxan by mouth with or without food, usually 3 times a day for 3 days. For irritable bowel syndrome with diarrhea, take it by mouth 3 times a day for 14 days. To prevent hepatic encephalopathy, take it by mouth 2 times a day. It's important to take this medication at evenly spaced times for the best effect. Try to take it at the same time every day to help you remember. If you're taking it for traveler's diarrhea, continue until the full prescribed amount is finished, even if symptoms disappear. If you're still having diarrhea after 1 to 2 days, have bloody diarrhea, or have a fever along with the diarrhea, make sure to contact your doctor. Let them know if your condition does not improve or if it worsens. Your doctor has prescribed Xifaxan because they believe the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to be aware of potential complications. In rare cases, Xifaxan can cause a severe intestinal condition due to a bacteria called C. difficile. This condition may develop during treatment or even weeks to months after treatment has ended. If you experience persistent diarrhea, abdominal pain, or notice blood/mucus in your stool, contact your doctor immediately. If you have these symptoms, avoid using anti-diarrhea or opioid products as they may worsen your condition. Although it's rare, a serious allergic reaction to Xifaxan is possible. Seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of potential side effects, so if you experience any other unusual symptoms, reach out to your doctor or pharmacist for advice. It's best to consult your doctor for medical advice about any side effects you may be experiencing. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Xifaxan, it's important to let your doctor know if you have any allergies to rifaximin or other rifamycins. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Be sure to inform your doctor about your medical history before using Xifaxan. It's also important to note that Xifaxan may affect the effectiveness of live bacterial vaccines, so be sure to let your healthcare professional know if you are using Xifaxan before getting any immunizations or vaccinations. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xifaxan should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. Additionally, it's unknown if Xifaxan passes into breast milk, so it's best to consult your doctor before breastfeeding while using this medication. When taking Xifaxan, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to seek your doctor's approval before starting, stopping, or changing the dosage of any medications while taking Xifaxan. This will help ensure the safe and effective use of the medication. If someone has taken too much Xifaxan and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center for assistance. This medication is prescribed specifically for your current condition and should not be shared with others. It should not be used later for another infection unless directed by your doctor. If you forget to take a dose of Xifaxan, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Xifaxan, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a safe place, away from children and pets. And when it comes to getting rid of any unused medication, it's important to consult with your pharmacist or local waste disposal company for proper disposal methods. Never flush Xifaxan down the toilet or pour it into a drain unless specifically instructed to do so. And always remember to discard any expired or unneeded medication properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.